Good afternoon. I'm your host, Tara McGrath, and the Communication Director for Los Angeles Rabbit Foundation. We'll first do an overview presentation covering the basics. Then veterinarian Dr. Sari Kanfer will be answering your questions. Please use the question and answer box during the presentation, and we'll get to as many questions as we can. Our first presenter, Emily Baker, is Education Director for Los Angeles Rabbit Foundation. She has an MA in Museum Studies from Johns Hopkins University and is also currently working as a museum educator at the Natural History Museum of Los Angeles County. Our second presenter is the founder of Los Angeles Rabbit Foundation, House Rabbit Society Chapter Manager, Michelle Kelly.
Thank you, Tara. So, GI stasis is an extremely common medical issue in pet rabbits, and how quickly you treat it is a matter of life and death for your beloved pet. So our goal today is to give you the tools to identify this condition so you can get your rabbit to the veterinarian as quickly as possible. Let's start off with what is GI stasis. Breaking down that term, gastrointestinal means dealing with the digestive tract, and the term stasis can mean inactivity or no change. In this case, it means to slow down. So the GI tract, that digestive system, is going very slowly, which, as we'll get into, can be deadly for a rabbit. Frequently, it's also a sign that, medically speaking, something else is wrong with your rabbit. And this is just a side effect symptom that may help you identify what else is going on. Dr. Donna Krempels wrote the famous article, Gastrointestinal Stasis, the Silent Killer. And I think that's really an astute way to put it. She starts off the article with a quote, "My bunny stopped eating and then she just died." It's something that we hear as a rescue all too often. And even though it's a condition that is often unnecessary fatal, the truth is there are lots of signs you as the pet owner can look for and catch before it's too late. When a rabbit doesn't eat, a host of other problems quickly develop, leading to a downward spiral. Therefore, whenever your bunny stops eating, consider it an emergency. GI stasis is the #1 reason for rabbit veterinary emergencies, and it's often, but not always, preventable, and it's usually, but not always, treatable. So here we see two different x-rays. The top x-ray shows GI stasis, which, as we just discussed, is a slowing down of the GI system. You see a gas bubble in that first x-ray, which is probably giving that poor bunny a tummy ache, but things aren't looking too bad right now. GI stasis is something you want to quickly fix before things get worse. The system may be slowing down, or you may have a small blockage that can still be moved along. The x-ray below is showing bloat. Bloat is when the digestive system is completely blocked up and starting to swell up with backed up food and water. The blue arrow is pointing out a spot in the GI tract that is bloated, and you see that stomach on the left side of the x-ray is filling up like a balloon with food and water with no place to go. This rabbit is likely in a lot of pain. As soon as you see a change in your rabbit's behavior, you need to go to the vet for x-rays to figure out if you're dealing with GI stasis or bloat, because veterinary treatment is going to look very different for stasis than it does for bloat. Either way, your rabbit is in a potentially deadly situation. So, common causes of GI stasis. One of the most common causes of stasis is ingesting fur. I'm sure you've seen your rabbit licking its fur clean just like a cat does, right? But there's a major difference between cats and rabbits. Cats barf up hairballs. After a cat ingests too much fur, it gets rid of it by throwing it back up. Rabbits do not have that same luxury, if you can call it a luxury. Anything that goes into the rabbit has to go all the way out the other end of the rabbit, whether it's fur or anything else it may eat. It doesn't help that a rabbit's shed season seems to last all year long. So as we said before, GI stasis might be a symptom of other ailments: overgrown teeth that you haven't spotted yet, pain of any kind caused by illness or injury, cancer, or a stressful environment. And other things to look out for are poor diet and limited exercise, parasites, and knowing that some rabbits with certain color patterns are prone to having these issues already, like the spot cross bunny you see here, who was a megacolon rabbit and prone to these sorts of issues. Overall, as soon as you notice a slowdown in eating or a change in litter box habits, it's time for the vet, because a lot of these catalysts for GI stasis are going to require a vet visit anyway. You've just now been given the signal that something is wrong. So some easy ways to prevent GI stasis include thoroughly bunny-proofing your house so they're not ingesting things they can't digest properly. So we see here a properly bunny-proofed Christmas tree. You want to make sure there's continued unlimited amounts of hay, because that fiber will keep your bunny's digestive system moving and grooving. You want to use water in a crock instead of a bottle. Two things on this one: a rabbit can slurp up more water than it can ingest by licking those bottles, which keeps it nice and hydrated. And then second, they're more likely to ingest more air when licking at a water bottle, which can lead to those painful gas bubbles. Plus, y'all have not lived until you've listened to a bunny slurp up water out of a crock. It is just one of the cutest noises on earth. So always be sure to brush your bunny, get as much of that loose fur off as possible before they can lick it off themselves, and make sure your rabbit is getting exercise and maintaining a healthy weight as well. And I know I've said it many times already, but it's the most important part. Know those warning signs so that you can act fast when you see them. All right, so the all-important signs of GI stasis. The key thing you need to look out for is input and output, making sure that GI system is always on the move. So input, if your rabbit typically dives face first into its nightly salad and then one night snubs it, that's cause for concern. If they're only eating some foods when they typically eat all of them, that's also cause for concern. My rabbit ate all of his lettuce one night, but when I woke up, his pellets were still in his dish. And we figured out that he had a tiny bit of hay stuck in his tooth that was making it painful for him to eat anything crunchy, including hay. And if we hadn't caught this change in his appetite, his digestive system would have gone into stasis without that constant flow of hay going through it, since it was painful to eat. Some owners try the treat test. If a rabbit refuses their favorite treat, you've got a real problem on your hands. And in that same situation, I tried giving my rabbit a piece of his favorite rabbit cookie, and he took it, but he just dropped it on the floor because he knew it was too crunchy to eat without pain. So input is only half the equation. You also have to watch the output. It's a big joke that rabbit owners are obsessed with their rabbit's poop, but really we're obsessed because it's a big indicator of health. As a rabbit owner, you should be constantly looking at what's in that litter box day in and day out. And we'll get to poop in just a moment. I know you're very excited for that slide. Some rabbits like to sleep in their litter boxes, but if your rabbit is hunched up and looking in pain in that litter box, or if they're spending a long time in the litter box and then keep shifting around without actually producing poop, these are bad signs. Beyond looking at eating and pooping, you want to keep an eye out for a lack of movement. Or if your rabbit is sitting in a weird way that keeps the belly pressed to the ground. Listen for tummy noises when your bunny is feeling healthy, so you know what a normal digestive system sounds like. And of course, keep an eye out for any signs of pain or anything else out of the ordinary. All right, poop. So that first picture is what you want to be seeing in the litter box: big, round, and hay colored. The more golden hay colored, the better. Next to it, you see a poop from a rabbit in stasis. You see it's misshapen, no visible pieces of hay, and dark in color. You've got two more unhealthy poops below that, including diarrhea. Neither of those are necessarily associated with GI stasis, but you still want to see your vet, of course. Another common poop you might see is, for better or worse, called the necklace poop, because it looks like a string of pearls. That's going to occur when your rabbit is ingesting a lot of fur and those poops come out connected by that fur that they ate. So when you see those, it means you need to increase the amount of brushing you're doing to your rabbit to collect the shedding fur. Now, it's also important to know that cecotropes, those two clusters on the right side of your screen, are not poop, but they are a normal part of the bunny's digestive process. So those are no cause for worry. All right, so we went over what GI stasis is, what can cause it, and what to look for. So I'm going to pass it over to Michelle now to cover what happens when your rabbit does go into GI stasis and the steps you need to take with your vet.
Thank you, Emily. Going back to the basics, always keep in mind that rabbits are small prey animals and as such are programmed to hide illness. If you suspect something is wrong, it probably is. Don't wait, call your rabbit veterinarian. Once you notice there's a problem, you have a very short window of time to get bunnies started on treatment. This is why you can't leave your bunny alone for 24 hours or the weekend. You want to have someone check in on your bunny every 12 hours if you go out of town. Here's how you define that emergency that may be connected to GI stasis. Bunny has not eaten for several hours and refuses his favorite food or treat. You may notice a dramatic change in behavior. For example, your usually shy rabbit allows you to pick him or her up, or your friendly rabbit all of a sudden gets nippy. If your rabbit is lethargic or wobbly, or his gums are pale, that's bad news. Any temperature under 100 degrees is cause for concern. Normal body temperature for a rabbit is around 101 to 103.5 Fahrenheit. If your rabbit is audibly grinding his teeth, that's a sign of extreme pain. Not the almost inaudible click, click, click with the jaw and mouth that we call the bunny purr, but a gritting or chattering sound that you can hear from a short distance away. If your bunny bunches up and presses his abdomen down to the floor, that's a sign of tummy pain. Gas often causes bunnies to shift a little bit, hop a short distance, lie down, pressing to the floor, shift uncomfortably, and move again. However, at the critical stage, bunny may not want to hop at all. If there haven't been any fecal pellets for an extended time, say it's been 12 hours, or the fecal pellets are gelatinous, or you see diarrhea, again, that necessitates a trip to the ER. Facing into a corner or hiding when they don't normally do so is another bad sign. Let's switch from talking about all the scary signs of emergency to what we can do about it, or to put in better terms, what your rabbit veterinarian can do to save your bunny. Full disclosure, I am not a veterinarian. That's why we invited Dr. Sari Kanfer here to answer your questions. Like many of you, I cannot diagnose nor prescribe. The reason we're including these slides on standard diagnostic and treatment protocols is first to help drive home the importance of having proper diagnostics and treatment done by a rabbit veterinarian. And second, to give you information that will help you to advocate for your rabbit's care. In order to diagnose GI stasis and any underlying causes, your veterinarian will likely palpate the rabbit's abdomen to feel for any masses or abnormalities. Taking a rabbit's temperature, looking at gums, and listening to heart and lungs will give your rabbit an idea of how critical your rabbit's condition is. It's also very important to do a dental exam to check the back teeth, because if your bunny is in GI stasis and you get her eating and pooping again, then if the teeth are growing into their mouth and causing pain, then bunny is simply going to relapse again. And meanwhile, the mouse could get more infected. It's important to address that and any underlying causes if they can be clearly determined. An X-ray is critical to help clarify if your veterinarian is dealing with GI stasis, bloat, liver lobe torsion, bladder, kidney stones, or any other cause of pain and impotence. I can't stress how important this is, because liver lobe torsion, just to give one example, can be successfully operated on, but only if you catch it in time. A blood test can also point to possible infection or underlying disease and can indicate if certain medications are likely to be contraindicated. Here's what to expect when your veterinarian diagnoses GI stasis. Adequate pain management is absolutely critical, so your veterinarian may prescribe meloxicam or one of the opioids. Your veterinarian will likely focus on getting the body temperature back to normal with a heating pad or incubator. Hydration prevents gut contents from becoming impacted, so it's very critical. Your veterinarian will likely administer fluids such as lactated vinegar solution. If your rabbit won't eat on her own, your veterinarian may administer or prescribe critical care, shown in the photo on the left, or Sar-X or another of the powdered emergency foods that you mix with water and syringe feed into the bunny to keep that GI system going. Speaking of moving things along, motility drugs are often prescribed to help with that, either cisapride or metoclopramide, otherwise known as Reglan, or both. When there are obvious gas bubbles showing on the x-ray, your veterinarian may also suggest using simethicone to help get that gas to pass. Your vet will monitor food intake and fecal output, or ask you to do so, and will likely recommend that your rabbit get adequate exercise to help with recovery and keep things moving on through. But what do you do if you can't get to the rabbit veterinarian? Perhaps none of the hospitals near you see rabbits, and the nearest veterinarian is booked solid and can't take emergencies. In these circumstances, it's helpful to know how to safely and gently take your rabbit's temperature with a flexible tip thermometer, an unscented sterile lubricant like KY jelly, and we'll show you how to do that later on. If your bunny's temperature is under 99 degrees Fahrenheit or even lower, the first thing you have to do is warm your rabbit up. I like the heating pads, like the one that you see to the right, that are designed for outdoor dog kennels or barn cats, because they have a hard plastic cover and the cord is wrapped in metal, which we all know is important when you're dealing with bunnies. They have just one setting, a low setting, and they don't get too hot. You will want to place a thin towel or the cover that came with the heating pad between the pad and the rabbit. Then wrap both completely around with a towel to keep that heat trapped in, and then recheck your bunny's temperature every 10 to 15 minutes to make certain that it's going up and that it hasn't gone up too high. Once your rabbit's temperature reaches a normal range, you can syringe feed watered down critical care, as long as this bunny is not feel very distended, like it could possibly be really uncomfortable to do that. Again, we don't want to syringe feed if it's bloat, but you haven't been to the vet, so you don't know. The most important thing is to get that temperature up, not to syringe feed. If you do syringe feed, I like to mix the critical care with a lot of water and a small percentage of, say, carrot or pumpkin baby food to make it both easier to syringe and more palatable. The 3 and 6 ml syringes are great for syringe feeding. However, if you're just starting out, 1 milliliter syringes may be safest. I don't like those big honking 60 milliliter syringes because it's too hard to control the flow and you don't want bunny to choke. It might help to keep your rabbit moving. If your rabbit wants to sit in a litter box, you can place him in a different spot, then he'll hop back to the box. You could do that a few times just to get things moving again, maybe have a bunny doesn't like around to get them worked up and moving. But you also don't want to stress them out, and you don't want to torment your bunny with that. Just try it to see if you can get things moving again. You can administer simethicone, which may help relieve pain from gas buildup. Simethicone doesn't hurt and it may help. You can find simethicone in the baby supply section of your local pharmacy or in the regular section under gas relief. See the bottom photo for a bunny next to some simethicone. You'll also want to offer food often to try to get bunny to eat on his own. Sometimes rabbits eat out of habit and may chew and swallow hay that's placed in front of them. You'll want to pay close attention because it may look like bunny is eating when actually bunny is just sort of snipping the hay in half. You will want to take careful notes on food intake and fecal output so that when you do get to a veterinarian, you can give him exactly a good idea. You can give your veterinarian a good idea of exactly what's happened and when. You can contact veterinarians for general advice if you can't get an appointment, but don't expect your veterinarian to prescribe without seeing the rabbit. Once you've been to the veterinarian, you may be given medication to take home and syringe feed, or your veterinarian may say to give your bunny critical care or sub-Q fluids. We're going to review how to syringe feed and give fluids later on. Let's say you went to the veterinary hospital and your rabbit is stable, but they want to keep her overnight. Ask yourself what they can do in the hospital that you can't do at home. If the building is going to be closed and no one's going to be there, then it doesn't make sense to leave your rabbit there overnight. Sometimes clinics like to do this because they want to have access to the rabbit first thing in the morning. What you do in that case is you offer to bring the bunny back. You say, I don't mind driving the bunny back and forth. I'll be here first thing in the morning. You can provide supportive care at home in a less stressful environment. Because remember, stress from boarding can also cause bunnies to not eat. So can being separated from a bunny partner if your rabbit is bonded with another. But if hospitalization means that a member of the veterinary staff will be assigned to monitoring the rabbit, or if the rabbit could be going home with the veterinarian, then they may be able to provide services that you cannot. In that sense, in that case, it does make sense to allow hospitalization to give your rabbit the best chance of survival. Much also depends on your level of experience with medicating rabbits. I didn't include it on this slide because it requires a prescription. So you'll be doing it at home after you go to the vet, but after warming your rabbit up, sub-Q fluids, that's lactated ringer solution administered under the skin, are one of the least risky ways to address GI stasis at home. Later on in our presentation, Dr. Kanfer will probably be talking about additional things that you can do at home after you establish a working relationship with your bunny veterinarian and perhaps have some prescription medications on hand. Here's what you should not do at home. You can't legally administer drugs without a veterinary prescription, and you can't diagnose without veterinary input. Just because the last time your rabbit stopped eating turned out to be hair ingestion and your rabbit recovered with just some simethicone and meloxicam doesn't mean your rabbit will recover this time. Since rabbits shed so much of the time, it could be coincidental the bunny is shedding when she stops eating, and the real cause of the bunny not eating could be something else altogether. Remember that the only way to clearly determine GI stasis versus bloat versus liver lobe torsion or bladder stone is an X-ray. Back to the basics. Rabbits are small prey animals programmed to hide illness. So by the time they exhibit symptoms, the situation already warrants immediate action. If you take a wait and see approach, there's a good chance your rabbit won't survive. Another thing you shouldn't do, you shouldn't syringe feed food or water if the bunny's temperature is under 99 degrees Fahrenheit. If his temperature is under 99, this means the bunny could be bloated or going into shock. Be very gentle with your sick bunny. Rough handling could cause a heart attack in an already compromised rabbit. Don't force feed roughly. Although rabbits cannot throw up, they can choke. So you will want to gently syringe feed. And don't ever massage your bunny's tummy roughly, because that can cause already weakened intestinal or stomach walls to burst, or the pain can cause them to shut down. Always be gentle with your rabbit. Please don't try to treat your rabbit at home for the sole reason that you cannot afford veterinary care. Your bunny is more important than money. You owe it to your rabbit to set up a savings account or invest in health insurance for your rabbit. But research pet insurance thoroughly, because pet insurance is not the same as human insurance. You pay up front and hopefully get reimbursed. In the United States, Care Credit can help cover costs if you don't have the money up front. It's like a credit card that is interest-free for a while, and then if you don't pay, then the interest goes up. Work with your veterinarian to help keep costs down and maybe get prescriptions for your rabbit that you can have at home. To summarize, learn what is normal for your rabbit. Any change in behavior, see a rabbit veterinarian. Be proactive. The best way to deal with GI stasis is to prevent it in the first place by providing a healthy diet with lots of grass haze and plenty of water and giving your rabbit space to hop. Learn in advance how to safely take a rabbit's temperature and how to syringe feed and maybe give sub-Q fluids. Establish a great working relationship with your rabbit veterinarian and perhaps have some meds on hand if you have repeat episodes. Finally, it helps to stay informed. Do your own research on forums that are sanctioned by and include exotic veterinarians. Just remember, online communities are not a substitute for a visit to a veterinarian if you have one in your area. This concludes our basic slide presentation, but please stay tuned because we have a well-known rabbit expert here in just a moment to answer your most burning questions about GI stasis. And after that, we will have a few videos showing how to take your rabbit's temperature, how to syringe feed your rabbit safely, and how to administer sub-Q fluids. With that, I'll turn the microphone back over to Tara, who will be introducing our guest veterinarian.
Well, thank you very much, Emily and Michelle. We are honored to have Dr. Kanfer answering your questions about GI stasis today. Dr. Sari Kanfer from Exotic Animal Veterinary Center in Pasadena, California, has advanced training in rabbit and rodent medicine and 20 years experience treating primarily rabbits. I apologize for that noise in the background. That is my bunny eating his cardboard house. She is a respected member of the exotic veterinary community and has saved countless rabbits suffering from GI stasis. Welcome, Dr. Kanfer. Thank you so much for being here. Let's get started with a really basic question. Can you summarize what happens when a rabbit goes into GI stasis? What sends them into that downward spiral? Then what happens when a rabbit is treated? How does recovery come about? What does it look like?
So as Michelle had mentioned earlier, or Emily, anything can cause GI stasis or, in a rabbit. I mean, you look at them funny and they stop eating. So, certainly I have found that when rabbits are shedding, they are a lot more likely to have either GI stasis or bloat. So, if your rabbit is shedding heavily, then definitely be on guard and watch them closely and ideally treat them with a hairball remedy like Laxatone or Petromold. So that's one way that you can try to prevent things. So basically you want to know what your rabbit's normal appetite is so that you know right away if it changes. And then, as Michelle mentioned, you want to act on it right away. For a dog or cat, might wait a day or two, see if they improve. With a rabbit, you wait like an hour or two to see if they will start eating or not. And if the longer you wait, the sicker they get and the more expensive the treatment gets. So there's GI stasis is the simpler version. It's rarely life-threatening. It can be caused by many different things. It's not necessarily going to develop into bloat. Bloat is usually an acute onset of a small chunk of hair or carpet or even a dry poop that gets stuck in the small intestine and physically prevents things from moving. And that's usually very acute. It happens, you can have a rabbit that eats its dinner, and then when you go to give dessert, that's it, forget it. They've made an instant change. So that can happen very quickly and can be very life-threatening. So you may find that you feel that the belly feels really big and full. So that's something that you can also do, is you can start to feel your bunny's belly and kind of get an idea of what a normal bunny belly feels like. It's nice and soft and mushy. Certainly some of the fat rabbits, it's hard to tell because they do have very big bellies that aren't very compressible. So just kind of getting used to what your bunny's belly feels like as well. Then the mainstays of treatment are going to be getting that temperature up and keeping it up. Fluid hydration, whether it's by under the skin or intravenously if they're in bad shape, and pain medication. Those are kind of the main things to start with. And with pain medications, usually we're going to want to go for an opiate like butorphanol, buprenorphine, or hydromorphone. Those are going to be safer than using meloxicam, which is Medicam. The Medicam is can be tough on the kidneys, and when you have any rabbit that stops eating at all, there is always some level of dehydration, period. So the dehydration affects the kidneys, and then the Metacam can compound things. So the ideal thing is to not give Metacam until you've hydrated the bunny, but sometimes you don't have any other options and all you have at home is Metacam. And so certainly it is better than nothing. If you don't have Metacam at home, you could always try a baby aspirin because those are safe, but definitely not very strong. So certainly the ideal thing, if you have a good relationship with a bunny experienced vet, is to ask them to give you a supply of emergency medications to have at home, including fluids, and to show you how to do them, do the sub-Q fluids. And so I do that with a lot of my clients. There are some veterinarians that are not into that, but then you may want to find a better rabbit vet. So, because most of the people who are really into rabbits as veterinarians are going to be like, yeah, sure, I want you to have some intestinal stimulants and pain meds at home. So, and then also, after the, secondary to getting the temperature up, pain relief and fluids would be intestinal stimulants to try to get things moving. I don't want to go into depth about whether or not you should use them, more than to say that, some people say, oh, well, if there's a blockage, you don't want to use a motility stimulant because you could cause a rupture. And then other people say, well, the motility stimulants aren't very strong. So which one is it? So, I've literally had rabbits' bellies open, looking at their intestines, given an intravenous injection of Reglan and seen the intestines move and then stop. So they do work. They're not terrible. You can use them with an obstruction because they're not so strong that they're going to cause a problem. But again, they're not really going to work. It's not like they're going to magically clear the obstruction, but they just help things move through. The main thing with getting that obstruction to move is to hydrate the rabbit, get their blood pressure up, get all that blood flowing to all of the organs. And that's what's really going to be the big thing for treating bloat. So did I answer the question well enough?
You did,
Okay.
thank you. So we do have a lot of questions. I'm just letting all of our attendees know that we're going to try to get to as many as possible. And Emily spotted one in our queue that she wanted to bring attention to, and so I'm going to throw it to her for a sec.
Yeah, I mentioned when I was speaking earlier that I gave my rabbit a cookie as a treat test and that he dropped it. And one of our attendees asked if we have an opinion on Oxbow digestive tablets and their ability to prevent stasis. And that cookie that I mentioned was actually one of those digestive tablets. So I use those as treats. I know they've got molasses in them. So I know that I need to be careful with that for my rabbit, who will eat as many treats as he can if he's got the option. But Dr. Kanfer, I was wondering, so I'm glad that this attendee brought this up, about the efficacy of these digestive tablets and if they're actually doing anything for the rabbit's digestion.
For rabbits that have chronic GI issues, I haven't seen them really do much. They're definitely not going to hurt. It's a good treat to use. I don't know exactly what the contents are. It may be some herbs that are supposed to help the GI tract work better. It's, you kind of, like, I use herbs and herbal therapy in certain instances, but you also have to be careful because, for example, like, you're not going to fix a broken bone with acupuncture, so they're supplemental. You could use herbal treatments to decrease pain and inflammation and boost the immune system, but it's still not necessarily going to fix an illness per se, for the most part. So it's not going to hurt, may help. I've definitely found the hairball remedies to be effective. When I first came out of school, I kind of, oh yeah, whatever, those don't work. And then I've seen it myself with my patients as well as my own rabbits. And so those I definitely do recommend. A high hay diet is very important because the hay actually is what's most important at regulating the rate at which food moves through the rabbit GI tract. And so in terms of supplements, something that's been super popular lately is Sherwood's appetite supplement. People have asked me about using. I looked at the label and it's basically sugar and electrolytes, which like Gatorade. So again, if you're getting some fluid into your rabbit, a little oral fluid, is not going to hurt. It may perk them up a little bit, but it's not a magic panacea. And I've definitely had other medications that work a lot better for increasing appetite. So I don't dislike herbal stuff and supplements. I do recommend them in many cases, but again, it's more of an additive added on to other medications that we're doing and treatments.
Thank you.
Okay, here's a question we got via email. Let's say my rabbit's temperature is under 99 degrees, not syringe feed at that temperature, but after a while, we get the temperature up to 100. We have no rabbit veterinarians available in the next 24 hours. Should I start syringe feeding once I get the temperature up? I don't want there to be no food in the rabbit.
At that point, yeah, once the temperature is up, and as long as the belly is not distended, you know, really, really big and balloon-like, you can try to syringe feed. You might want to make it very watery or use even some baby food, and just do maybe like 5 to 10 mLs every 2 to 3 hours. And again, if the rabbit's not swallowing, that's bad. Don't force it. It may help, you know, worst case scenario. Yeah, it certainly could make things worse if there is a true bloat, but it also could make things better. I did have one client who syringe fed, I think like 25, 30 mLs, and the rabbit's stomach ruptured. So you do have to be careful of that, but small amounts, and then wait about 3 hours, and then another small amount while keeping the temperature up and monitoring that, then many times that is going to help. Now, in terms of rabbits and GI stasis and or bloat, I would say probably 75% of them are going to respond to fluid injections, basic pain relief, and, you know, syringe feeding, small frequent amounts. And again, if you have the medication at home, sometimes the owners start the treatment and they do great. Or if we have an owner who comes in and they can't afford to do x-rays, blood work, hospitalization, and so all we're allowed to do is a dose of fluids and a dose of pain meds and go home and cross your fingers. And those rabbits, even if they are a bloat, like a mild to moderate bloat, will respond to those treatments 75% of the time. But there is still that 25% or so that is going to need intensive care. And so, you know, and a lot of times we'll have a rabbit who comes in with a mild to moderate bloat. And yeah, maybe it would do okay on minor treatment, but between me and the clients, we don't want to take that risk. And then we go ahead and we do the intensive care treatment, and then boom, they're better in a few hours. So we're just really ensuring that we're not taking any chances. And so, I mean, that, I don't know if you want me to sequela into different levels of vet care. I wanted to touch on that. Is that okay?
Yeah, of course.
So, you know, we're talking so much about, oh, go to your rabbit vet, go to your rabbit vet. You need a rabbit vet, you need vet advice. Absolutely, it is very important, but I do understand that you can't always access a vet. And surprisingly, even in LA, 10 o'clock at night, your rabbit gets sick, you're kind of screwed unless you can do a lot of treatment on your own. So that's really a sad thing. But so that's why being prepared, being able to keep them warm, taking their temperature, sometimes even that alone will do the trick. And it really, really helps a great deal. And sometimes you know, even a basic ER can't necessarily get the rabbit's temp up in a timely manner. So if you take some of these recommendations, then you can be better at that than some of the average dog cat places. Certainly, you know, if you go to your either an ER or you go to your regular vet during the day, yes, the ideal best top quality care is going to be x-rays and blood work. And the x-rays are 2 views. But for those places that only see maybe 30% exotics or less, they may not offer you that. They may think that they may not even say anything about it doing it. Or you might say, hey, do you want to do x-rays? And they say, nah, your rabbit's fine. I think it'll be fine. You can insist upon it. Can they read the x-rays? That's the other thing too. And so sometimes your vet might make it sound like they know well enough, and they don't really. And so that's a really hard thing to know. If you're in touch with your local rescue groups, they can oftentimes give you that personal information. You know, on the website, they may list everybody who sees rabbits, but if you talk to somebody, they can kind of maybe guide you towards the more experienced people. Certainly, again, if your vet doesn't do x-rays, doesn't do blood work, at the very minimum, they should give warmed fluids under the skin, the pain relief, send you home with pain relief and intestinal stimulants and keep the temp up. So at the very minimum, and as I said, that's going to take care of majority of these cases. So even if you don't have a great vet who's going to identify that there's, you know, kidney infection or a bladder stone that's causing this, then at least they can stabilize your animal.
So we have in Los Angeles, after hours, we literally sometimes have a 4 to 8 hour wait time at the emergency hospital. So what I've been advising people to do is put hot water bottles and wrap them in a towel and put them in the carrier with the rabbit if the temperature is low, because it could be hours before the rabbit is even seen at the hospital. And then meanwhile, Bunny is tanking. Would you agree with that? And do you have any other advice for people who want to get their rabbit to the vet, but they have that wait time?
Yeah, I 100% agree with the hot water bottles, you know, and I think if you're taking the temperature at home, it's so important, you know, and before you go, and even bring your supplies with you, your thermometers, your hot water bottles, your blankets, you know, a heating pad, and say, hey, where can I plug this in? You know, it's really sad in this area how the animals are waiting in the lobby without even being triaged. So that's extremely sad. When we have emergencies, even though we're a day clinic, somebody, you know, comes in with a sick animal, it gets triaged immediately. If they're stable, okay, maybe they wait and they're in a cage with food and water until they can get x-rays and blood work for a couple hours. Maybe the owner can't get a doctor to talk to them for a couple hours, worst case scenario, but at least the animal has been triaged immediately. And if they are in very, very bad shape, then everything else gets dropped. And then we focus on that really sick animal. So it's a very sad thing that you could sit in a lobby in these ERs for 5 hours with nobody doing anything for your pet. I agree. The one thing to be careful of is if you have the 2 hot water bottles, you know, wrapped up in towels next to your bunny in the carrier, because it's a smaller area, it really will warm them up faster. So you do have to still be careful that they're not getting overheated. And that's why I do recommend checking the temperature every 10 to 15 minutes while on the intensive heat, because once they get up to 99 or 100, you're going to want to start to decrease your heat. And then especially if they're getting over 100, taking them off, but then they could drop down again. So you do have to watch them very closely. So we're basically treating you to kind of be bunny nurses.
Thank you.
I am seeing a lot of questions about people who have medication on hand, you know, meloxicam or even sub-Q fluids. The shelf life is pretty short on those items. They're asking, you know, how long is it safe to keep using them after those dates, especially when it comes to sub-Q fluids and meloxicam?
Yeah.
Or if you
Excellent question. With the meloxicam, usually it expires in about a year. So I would be surprised if your vet is labeling it shorter than that. You know, find out from them if they, you know, from the technician, you say, hey, did you check the bottle, or is it just a routine, like everything is only good for 2 weeks? So, you know, the other thing also is that you can buy meloxicam, Medicam, and fluid bags online. You just will need a prescription that your vet will have to authorize. There are a few vets who are very anti doing that, but it just makes it more convenient. You can buy in bulk, and a lot of times it is less expensive. So, and if you do that, then you know the expiration date for the Medicam, for example. Is it good past the expiration date? Hey, if it's the only thing you got on hand, it's better than nothing. You know, a Sunday night at 10 o'clock, and then you just, you know, the next morning you call in for a fresh refill. So, so it's better than nothing. You know, some of the compounded medications, I'm not sure if people know what compounded means. It means that it's not manufactured, and then we have to get a special veterinary compounding pharmacy to make it up, or it only comes in pill form. So we make it into a liquid for our little guys. And so those oftentimes only have like a 2-week or 2-month expiration date, because they're not being manufactured commercially. When it comes to fluids, the bags themselves, if they're not opened, I think are good for like a year or 2. But once they're open, certainly the ideal thing is to use it within 2 to 3 months. And so if you have an emergency bag on hand that's unopened, as soon as you open it, just go ahead and order a new bag to have on hand in case of emergency. I recently had a client who had an old bag sitting around. It's all she had. She went ahead and gave a dose of fluids, and then immediately after she gave it, she noticed that there was mold in there. So very concerning. So yeah, check your bags. If you see any particulate matter floating around, any discoloration, do not use it. So, so good thing to kind of just make sure you have an unopened bag. And also, you know, some people will want to reuse needles or syringes for injections, and it's not recommended. Recommended to use fresh, sterile ones.
Yeah, that makes sense. Another question we have from email. Following treatment and stabilization for GI stasis, why does it sometimes take weeks for some rabbits to begin to want to eat? Or why do some rabbits only reluctantly or sparingly eat small amounts of a select food for weeks after recovery?
Good question. And I think that also touches on the possibility of there being an underlying condition. Is there a tooth way in the back that the doctor didn't find? Is there underlying infection that they didn't put it on antibiotics? Because we're not supposed to use antibiotics unless we really need to. And so, but there are some cases where if they don't bounce back right away, I'll just throw them on antibiotics. And usually that makes a big difference, you know, especially if the owner doesn't want to pay for like a urine culture or anything major like that. You know, so if your vet hasn't done x-rays or blood work, definitely need to do that. If your rabbit's not bouncing back within a day or two, to figure out what might be going on. Certainly, the other thing I have found that is the biggest cause, two of the biggest causes of failure to respond in within a few days and taking a week or two to respond, because these rabbits with stasis should be better within 2 to 3 days, you know, significantly better. If not, the causes are either they're not getting syringe fed enough or they're having a reaction to a medication. I've actually seen rabbits that you start them on Medicam for pain. Maybe they initially feel better, but then they don't want to eat. And they actually are literally having an upset tummy from the Medicam. And we stop the Medicam and like 24 or 48 hours later, they're doing much better. So I've also seen rabbits who get a little too sedated from the opiates, from the butorphanol or buprenorphine, and that can cause them to not eat. But a big thing I think is that they're not getting syringe fed enough. Either the veterinarian hasn't told you to feed enough and you're doing 10 mLs twice a day for a 5-6 pound rabbit, or you think, oh, you syringe fed 1 or 2 times, the rabbit starts eating, so you stop thinking, oh, okay, he's going to eat. And so really your best bet is to feed enough. If you're not getting enough food in, they start to break down their own fat and muscle. The fat builds up in their liver. They get fatty liver disease. So it becomes a vicious cycle. They don't want to eat, so they're not taking in enough food. Liver is sick, and it just is a cycle. And so with a, you know, I had mentioned about starting off with small frequent meals of about 10 mLs every 2 to 3 hours. But for once we get the gut moving, if there's poop being produced, and maybe x-rays have been done, it's not a stasis, and we just want to make sure to get enough food into the rabbits. For an average 4-pound rabbit, you probably want to do 20 to 30 mLs 4 times a day, you know. And I don't know what you guys suggest. I think that's about a good amount. The other thing you can do is you can monitor their weight on a scale every day. If their weight's going down, they're not getting enough. Recently just had a, you know, like an 8-pound rabbit that was only getting 20 mLs. And so he started losing weight. So I told the owner they have to do 40 to 50 mLs 4 times a day. So you definitely have to you know, get more food in.
I'm seeing a lot of questions, variations of questions about preventatives and trying to get ahead of GI stasis. Besides, obviously, what we talked about in the presentation, which is brushing the rabbit and making sure that they eat enough hay and everything like that. I've seen a couple people ask if, sorry, let me just make sure I'm reading this. If critical care can be used as a preventative, or simethicone should be given during molting season to try to prevent blockages. Are either of those things something you would recommend or suggest?
Well, as I said, I recommend the Laxatone or Petramalt strongly. I've found it to be very effective. If your rabbit is going to be boarding or if there's workers in the house, if there's going to be a big change, if you're traveling with the rabbit, then, definitely treat it. You can treat it with intestinal stimulants and or appetite stimulants during the stress, and, supplement with syringe feeding as needed, feed them extra of their favorite foods, just to encourage them to take in enough food. Simethicone, it doesn't hurt. How much it helps, I don't know. I mean, I've had rabbits with chronic gas issues or acute gas issues, and I haven't really felt like the simethicone does much. I'm not going to tell you not to use it, but I don't have a lot of faith in it. I really, as I said, I have seen the Laxatone be very helpful. I've had some rabbits where if you don't start it, as soon as they shed, boom, that's it. They're going to stop eating. And so I've seen it be very effective. And yes, I do have rabbits who are chronic shedders, and they're on Laxatone almost every day. I have one of them in my own house. So that would be the preventative. In terms of critical care, syringe feeding, if you're seeing signs then of GI slowdown, then you're absolutely within rights to syringe feed. Like if the appetite is just decreased by half or a third, absolutely start syringe feeding. If your rabbit is totally healthy, syringe feeding them is not going to prevent anything. If anything, giving them the soft food on a regular basis is going to potentially cause their teeth to overgrow.
That makes sense. And in the same regard, someone's asking about pineapple preventing gut blockage because during shedding. Is that something that's true, or is that just a old wives' tale?
Wives' tale. I think somebody took a cup of pineapple juice and threw a hairball in it, and eventually over a couple of days it dissolved.
There you go.
Yeah, basically if you say, oh, well, I gave pineapple juice or the papaya tablets and my rabbit started eating, it was coincidence. You got a little bit of sweet fluid in there, and you got lucky that things started moving. So yeah, it's an old wives' tale.
Okay, great. Good to know. Someone else also mentioned the papaya tablets as well, so good to know.
They're a good treat, but
sorry. Yeah, one of those things that it's one of those things that maybe doesn't hurt, but it's probably not going to help. So what would you say is one of the biggest mistakes that rabbit caretakers make in connection to GI stasis?
Waiting.
Not noticing. Waiting.
Yeah.
Okay.
Rabbit, there was a rabbit that stopped eating last night, or not, night before last. So Friday night, stopped eating, and they didn't tell, it was a foster bunny, and they didn't tell the person, the rescuer, until 5 p.m. Saturday. And not much you can do at that point. And they did take him to emergency, but it was really bad and he died. So maybe if they'd let us know, and sought help immediately, either Friday night or Saturday morning. So.
Interesting. And I have also seen a bunch of people asking about cecotropes and if an excess amount of cecotropes not being re-ingested, if that means there's a sign of some sort of digestive issue.
Question. Excess cecotropes are usually because of obesity, too rich of a diet, like they're getting a lot of pellets or a lot of greens and they're just not eating a high enough percentage of hay. It also can occur with arthritis, if they're too arthritic to reach around and get them for themselves. And there have been occasional rabbits who are just pigs and they just don't eat their cecotropes and they step on them and get them smeared on their butt. But that's very, very few. Mostly if I see excess cecotropes, it's telling me they're just getting too many pellets and greens.
Okay, good to know. That's also good to know for myself too.
And then in that picture also, yeah, it's just key to know the difference between true diarrhea and smeared cecotropes.
Oh, yeah. And does feeding too many veggies cause stasis? Would that be something that could, or just?
It's rare for a rabbit to have GI upset to greens or even diarrhea from greens. I have seen a few rabbits where the owners are absolutely convinced that if they get any, like one leaf of lettuce, they have softer poop or they have a grumbly tummy, and it's very rare for it to really be true. A true reaction. Usually rabbits can tolerate greens just fine. So you know, the key thing though is to keep the rabbits as healthy as possible is to really limit the pellets, limit the greens so that they're eating primarily like 80 to 90% of what they're eating should be hay. And that's going to keep your rabbit the healthiest in terms of the gut moving and the teeth wearing down.
Okay, that makes sense. Swinging back to the motility drugs for a sec, cisapride and metoclopramide. Sorry, I am not good at reading long words like that I'm not familiar with. What is the difference between those two?
Thank you. So metoclopramide, also known as Reglan, they're both motility stimulants, so they get the intestines to move better. The metoclopramide supposedly works better on the stomach and the small intestine, the front part of the gut. The cisapride supposedly works better on the hind gut, the colon and the cecum. Now you can use them both together. That's fine. They're, you know, sometimes you're going to get a better effect. The cisapride only comes in an oral form. The metoclopramide can be oral or injectable.
Okay. How dangerous is it to give motility drugs when a rabbit has complete blockage?
I had mentioned that earlier. I think it's fine to do it. I think the important thing is hydration. Of course,
Right.
you know, hydrate things so they can start moving. So I usually will give fluids and then, you know, start fluids and then maybe wait an hour and then give intestinal meds. But that's when I'm, you know, treating them myself. If you're at home and you're freaking out, your rabbit's sitting there with a low temperature, and you give Reglan at the same time as you give fluids and Medicam, that's probably going to be okay, you know, or if you want to give the fluids and the Medicam first and then wait an hour till you give the Reglan, you know, it's not going to make a huge difference. But in, you know, for me, especially if there's a lot of dehydration in the gut, my preference is to start hydrating things first. You know, as I said, I really haven't seen Reglan and cisapride be so strong that they're going to cause a problem with an obstruction, and they may help. But I do feel like, you know, and some people say, oh, they don't work at all, but I do believe they do help. But again, it's not like an on and off switch either. It's additive. The other thing also I wanted to mention is when we talked about the opiates earlier, the butorphanol, buprenorphine, and hydromorphone, some people might have heard that they can cause GI slowdown. There have been tests that have been done and reports in the literature that say that yes, those medications will slow down the gut. But bottom line is if you don't get the rabbit out of pain, nothing, you know, the other stuff's not going to work. So you have to give them something, and the opiates are very safe, and the slowdown is minimal. With talking with other exotic vets, we really feel like clinically, like in the practice, we're not seeing it cause a major issue and slow down. In the lab, if you do a test in the lab, okay, so maybe there's some slowdown. But when we're using it, we're not really seeing it have a huge effect. I like the Benebac over some of the other products because it has a few more types of bacteria. But again, none of the products really have the right bacteria for rabbit intestines. And also, how's it going to get there? Is it really getting all the way into the intestine? So it's a challenge, but doesn't hurt, may help.
A lot of people seem to be asking about Laxatone, the dosages, the flavors. I know you already went over a lot of this, but do you mind just kind of reiterating how that works?
I think it's malt flavor or plain flavor is the ideal. You want to avoid the tuna flavor. You know, Laxatone is basically molasses and Vaseline. There's other products that are similar but have a lot of different additives that I kind of get nervous about. But if it's Laxatone or Petramalt, those are good. And usually I'm going to say to do about an inch or about an ml per rabbit per day while shedding. And if you have a pair of rabbits and one is shedding, give it to both rabbits because they could be grooming the other one. So, and you can either give it with a syringe, like you take the back out of the syringe, squirt it into the syringe and then put the plunger back in, or you just put a little dollop on the plate and a lot of rabbits will take it. You know, in cats, they say to put it on their paw so that they lick it. And we tried that once and the rabbit just groomed the Laxatone all over their face and the owner was pissed.
Someone did ask, her rabbit does not have any teeth. So it's a little bit hard to get them to eat hay and pellets. If there's any recommendation to try to get them to eat that kind of stuff so that obviously their gut keeps moving, because obviously hay is very important.
So they don't have any teeth at all, or just no incisors?
It just says missing teeth. Unfortunately, she did not specify.
Yeah, when
Need it.
rabbits have a lot of dental problems, sometimes they just aren't going to be able to eat hay. If they're healthy enough, you can try alfalfa hay, especially the soft part of it. And they might eat a little bit more hay, but yeah, there's sometimes you just nothing you can do for them. And sometimes they even can't eat enough food to keep their weight up, and they do need to be chronically supplemented with critical care. But most rabbits can get by with just pellets. And I've had rabbits who have no working teeth at all, and nothing's meeting or grinding, and they eat pellets primarily, and oats. So, and keep their weight up. In terms of how to keep their gut going, you could always just keep them on chronic Reglan if they're having, chronic GI issues. But then also, if they're having chronic GI issues, are they having underlying dental pain, chronic dental pain, or a simmering infection? So why are they still having chronic GI issues?
We have a couple of people who are actually out of the US, and I don't know if you'll be able to answer these, but I'm going to ask you. Someone was asking about dextrose powder. If that's something you're familiar with. No. Or
Gatorade, you could give the Sherwood supplement. I mean, again, it's just sugar water. So it's all
okay.
So, maybe is it going to stimulate their appetite? I know actually in children, like sugar water is to decrease nausea. So, but in general, when rabbits get stasis and bloat, their blood sugar actually jumps up quite a bit. So, and plus sugars like carbohydrates, which we really don't want rabbits to eat a lot of. So it's not the greatest thing to be giving them a whole bunch of sugar, but just a little bit is probably not going to hurt.
Here's how to take your rabbit's temperature safely. You'll need at least one flexible tip thermometer, sterile unscented lubricant like KY jelly, and alcohol or another disinfectant to sterilize between readings. If you live in an RHDV2 area, you'll want to make sure the disinfectant is good for that. Turn Bunny upside down, but with head up, like this. Locate the rabbit's bottom, which is going to be closest to the tail. So here are the genitals up here, and then you have the scent glands on either side, and then this is where you're going to be putting in the thermometer down here, closest to the tail. It's really important that you get the right hole and then not put the thermometer in the wrong place. So you want to use a little lubricant on the thermometer and on the bottom. And then slowly and gently insert your thermometer into the bunny. It's okay, sweetie. I'll try again. There we go. And then press a button to get a reading. 102.1. Very good, sweetie. That's a normal temperature. Normal rabbit temperature is 101 to 103.5. If the temperature is below or above that, call your veterinarian. But before you call your vet, double check the temperature either by taking it with the same thermometer again or using another thermometer. You're such a good bunny. Yes, you were. Don't forget to sterilize your thermometer and store it in a clean, dry place. Syringe feeding. Prep your formula immediately before feeding. Follow your veterinarian's instructions in terms of how much critical care, SAR-X, or other emergency food to give your rabbit. I like to water it down quite a lot. See? And then add either carrot or pumpkin. This is pumpkin baby food, both to make it more palatable and easier to move through the syringe. Temperature of your formula should be warmish but not hot. In terms of syringes, I like the 3 or 6 ml syringes, but some people feel more comfortable using this 1 milliliter syringe. The larger syringes may suddenly throw a lot of food in your rabbit's mouth at once, which could lead to choking. You definitely want a syringe with a longish tip to get into the rabbit's mouth. Squirt the formula through the syringe to make sure it flows and that you're getting any air bubbles out. So next you'll want to set up a counter or table with a towel on it, or place a towel on your lap. Hang in there, bunny. Don't go anywhere, bunny. Either method allows you to scrunching over the rabbit so she can't hop off. We have found that burritoing the bunny, which is that's when you wrap them all up in a towel with just the head sticking out, isn't for us because it stresses out the rabbit too much. Now let's get started with the feeding. Locate the corner of your rabbit's mouth behind the incisors. I like to use the pinky finger or the index finger of one hand to do that. Then you slowly and gently drop the formula, let me move this aside, into the corner of the rabbit's mouth. There we go, sweetie. Nom, nom, nom. Wait a bit and make sure the rabbit is swallowing. Don't worry if some get spilled, but it is a concern if your rabbit won't swallow at all. If your rabbit won't swallow or starts breathing heavily or seems overly distressed, do not continue syringe feeding and notify your veterinarian. Once you're done, discard any syringes used. Leftover formula should be refrigerated and used within the date specified on the package. Do you want more? You're such a good girl. Administering lactated ringer solution to rabbits is easier than you may think. There are two basic ways to administer fluids to a rabbit. You can use a large syringe and simply inject the fluids, or you can use a drip bag. I like using a drip bag because it's easier for one person. You will need a bag of lactated ringer solution prescribed by your veterinarian. And by the way, you can save a lot of money by getting these online. Clean line to attach to the fluids, and you'll want to use a new line with each new bag of fluids, and either an 18 gauge or a 20 gauge needle to attach to the line, depending on whether or not you have a wiggly bunny or if your bunny is extra sensitive to needles. The 18 gauge needle is a larger needle, and it enables the fluids to flow more quickly, and that way you get it over with quicker. But some rabbits are ultra sensitive, so you can use a 20 gauge needle if you want to. Make sure there's some fluid in the reservoir so that you can tell how quickly your fluids are dripping through. You'll want to flush the line to get rid of bacteria and air bubbles. Your veterinarian may prescribe warming the fluids before you administer them, and I like to use hot tap water in a bowl and run the line through. And the reason is because the rabbit's normal temperature is 101 to 103.5 Fahrenheit, which means room temperature is going to be a little bit chilly for the bunny, but you also don't want it to be super hot. And that's why I suggest flushing your line to get out air and bacteria at the same time that you warm the fluids through this bowl of water. All right, now I'm going to have to take this needle off so that I can test the temperature. You can run the line through and then flush it. Turn this on and flush the line at the same time that you test the temperature on your wrist to make sure that it's warm but not scalding. Then you'll put a clean needle and hang it back up. Place a towel on your table to provide traction. Now that you're all set up, it's time to get your rabbit. Since you're up on a table, you want to have control of your rabbit at all times. You can gently press down on her head or offer a treat, whatever works best for you and your rabbit. You will be injecting fluids into the loose skin on the back of your rabbit's neck. Wetting the area with an alcohol pad helps flatten down the hairs and makes it easier to see the injection site. Make a tent with one hand and inject your needle with the hollow side up under the skin at a 45-degree angle. You'll feel a pop as it goes in. There you go. Then you hold this area and turn the dial or slider on the line to allow fluid to flow into your rabbit. There we go. And look at your reservoir chamber to see if the fluids are flowing. And if they aren't flowing, you might have to adjust the needle in the bunny, see if there are any kinks in the line. There we go. After administering the prescribed amount of fluids, you will want to shut off the flow. I'm going to pull it out and put your rabbit back to his living space. Immediately attach a clean needle to your line. Discard old needles in a hard plastic container following the laws where you live. It's best to keep your fluids hanging upright to keep them sterile. Write the date on them and use up within a week if possible. Another way to administer fluids involves using a very large syringe with a 20-gauge needle and lactated Ringer's solution in a bottle. You simply draw the exact amount your veterinarian prescribes into the syringe and inject the fluids under the skin the same way you would put the needle in when using the drip bag. Change your needles with each use and discard your syringe after 2 uses. Thank you for watching and good luck.